Just still amazes me. We're not all here unified, just amazed at the fraud that we're uncovering and it just robs people who need Medicaid. And so Dr. Oz recently said that in South Florida, and I know you just sent a letter to Florida. I don't know, Florida was the state that President Trump won, if I'm correct, and the Republican there, who's a friend of mine, is governor. I mean, the governor's Republican, which they said they only do on Democrat governors. That's just not accurate. So Dr. Oz recently said that in South Florida, there's twice as many durable medical equipment companies as there are McDonald's. In LA County, California, 89 hospice companies are registered to a single address in Van Nuys. Are there patterns? So I don't know why this doesn't offend everybody, but I don't know. It's just a different world, it appears here. Are there patterns in geographic concentration of Medicare fraud that CMS is seeking and tracking, or seeing and tracking?
Absolutely. In fact, we see very much different geographic patterns and pockets across the country. South Florida has traditionally always been a hotbed or epicenter of fraud. One of the reasons that the McDonald's stat that Dr. Oz is so fond of remains accurate. The fact of the matter is there's always a high number of durable medical equipment suppliers in that area, largely because you have a beneficiary population that is not always as familiar with the benefit. English is not their first language. They are more easily taken advantage of by these fraudsters. And so as a result, we see a higher percentage of all types of fraud. Similarly with Los Angeles, with Texas, particularly Harris County and other parts of southern Texas, we see the migratory patterns to many other areas of the country. Hospice, home health, and durable medical equipment are the top 3 areas that we typically see this happening. And when we shut it down in one area, it's like whack-a-mole, it pops up in another.
Thank you. So also, CMS has historically relied upon pay and chase model, processing claims first and pursuing fraudulent payments later. Given that recovering funds from bad actors is often costly, time-consuming, and/or unsuccessful, can you walk us through what CMS is doing to shift resources towards prepayment review and front-end fraud detection?
Absolutely. We're using a variety of tools for this, and this is one of the things that I am personally most excited about, having done this for several years and had to spend time chasing after that money. We can now stop it on the front end, and we're doing it not only through the war room that I described earlier, where we're looking at the most egregious of providers, at least 5 a day, and we've managed, as I mentioned before, to stop over $2 billion to date. We're also now using new algorithms that we can get using machine learning and artificial intelligence to be able to run edits, to be able to stop payments from going out the door. Some of the new edits that we have used, we are able to see millions of dollars a week that we are able to stop before those claims even get paid. And that's where it's going to make a huge difference going forward.
So in the last hearing we had on this, the minority brought a witness that tried to define the difference between fraud and improper payments. And saying these were improper payments, not necessarily fraud. That's what the witness was trying to bring forward. If you have 89 hospice companies registered to one address in Van Nuys, California, what is the probability that's not fraud?
It's a very low probability would be my estimate. And what we've seen is when we go to validate that, it ends up being that the majority of them are fraudulent. These are not improper payments. An improper payment is when you have a documentation error or when you have something that is billed incorrectly. Fraud is when you are deliberately and intentionally seeking to defraud the federal government. And that's what we're seeing in these companies that have 80 plus in one building and where people are taking advantage of our most vulnerable citizens.
So that's what you say, when you defraud the federal government, you're defrauding the taxpayer and you're defrauding the people who receive these benefits.
You're hurting everyone. The more dollars that go away from our ability to take care of people, like in the house that I described in Florida, or in California we saw last week, that's dollars that should be taking care of them, not dollars that should be going overseas or to fraudsters to buy houses on the beach.
Well, I know California does, I pointed out Florida does have a Democrat governor, but people should still be offended by this fraud, wouldn't you say?
As a taxpayer, everyone should be offended by this fraud.
So how's the Fraud Defense Operations Center work? We got a half a minute to kind of explain.
Sure. The way it works is we get a mix of fraud investigators, lawyers, law enforcement, HHS, OIG, DOJ, medical professionals all together, and we look at the data. Again, it's all data-driven. We look at real-time Medicare claims data and determine where we see big spikes in the data. So for instance, on skin subs, last year, one of the cases we saw was an 89-year-old woman who it showed that she had 5,029 claims for skin subs submitted on her behalf, and she was on hospice. So obviously, that's a pretty clear indicator of fraud.
Is that improper payment or fraud?
That would be fraud. And she would be mummified if that was actually the case. And so at the end of the day, what we're looking to do is to use the Fraud Defense Operations Center to go after these and to determine where we're seeing things like genetic testing or other types of emerging frauds so that we can stop them before they become a bigger issue. Catheter fraud is a great example of that. You may recall that issue. CMS was actually able to stop over 90% of that before it even went out the door. And that was huge because that was billions of dollars that was being organized by deliberate groups that were seeking to defraud the government and send that money overseas.
Tough to defend the indefensible. My time is expired, and I yield back.
The gentleman